Hi everyone. Today I wanted to do a bit of a different video for my channel. This is my first ever video essay! Yay! And it's quite a political video, so I hope you don't mind. So my inbox over the past few days has been full of people asking me about Finnish healthcare since American politician Nikki Haley recently made a few claims about how bad the Finnish system is. The Finnish government also recently collapsed, in part because the Prime Minister's healthcare reform plans fell through. Naturally, right-wing media outlets, and even some less-informed neutral media outlets, have managed to spin both of these things into Finnish healthcare services being in a death spiral. But is it all really that bad? Well, no, it's not. Before I address Nikki Haley's comments, I'd like to state a few general facts about Finnish healthcare and Finland's government system. First of all, there are very few healthcare services in Finland that are actually free. Almost everything costs something. For example, a visit to the doctor in the public health center costs about 20 euros. A visit to a specialist, like a gynecologist or an eye doctor, costs 36 euros. Blood and urine tests don't cost anything, but x-rays and ultrasounds do, or at least sometimes they do. I haven't exactly figured out when they do cost and when they don't. Sometimes I get invoices, sometimes I don't. A trip to the emergency room costs 36 euros, regardless of how much or little they do to you. So if you go to the ER and they send you home with painkillers, or if you go to the ER and they take blood, give you an IV, examine you, and keep you there for several hours, it's the same price. If you need to stay at the hospital for several days, you are charged per day. Hospital costs are also capped at around 700 euros a year, so no one will ever pay more than 700 euros in a calendar year for hospital services. If you need medication for a very serious disease, the doctor will give you a statement that will cap your medication costs at 4.80 euros every 3 months. However, as of 2017, there is a €50 copay before defaulting to the 4.80 euros. So for example, I have glaucoma, and my glaucoma medication costs 4.80 euros every 3 months, but the first dose always costs the full price, which is something like 36 euros. And then by the time the second cost rolls around, I've defaulted to the 4.80. The €50 copay measure was and is heavily criticized by opponents of the government, who feel it puts extra financial strain on the poor and elderly. If these prices are still too difficult for someone, that person has the possibility to get help from the social services. But it's not always that easy. If you need to see a doctor for a non-urgent matter, you sometimes might need to wait a few weeks. However, urgent matters will be handled, well, urgently. This is where many Americans get confused about our system. Yes, we do have to sometimes wait to see a doctor, but never because of something that is going to kill us. You are also more than able to see a private doctor, which will cost you anywhere between 75 to 100 euros, depending on which private facility you use. I sometimes use the private doctor if I know I need antibiotics, for example, but don't feel like calling the public service and hoping there's a time available that day. Or waiting for the urgent care line. In the past, I've gone to urgent care, which is not the same thing as the emergency room. Urgent care happens after 2 p.m. at my local health center, and basically just means you wait to see a doctor. Any doctor. Whoever has the time for you. When it comes to children, most things are free. All yearly checkups, vaccines, and basic care for children is free. Specialists, however, still cost. The yearly hospital fee cap applies to children as well. So, if you and your child are both sick in the hospital, it'll cap out at 700 euros for the both of you. Now, for the Americans out there, when a country with a parliamentary system has a government collapse, it does not, in fact, mean that we have become a lawless war zone. It just means that we don't have a parliament. Services still work. The lives of average people don't change. The reason this collapse is especially underwhelming is because Finland had elections scheduled already for April the 14th. Many, both in the government and in opposition, feel that this was just a stunt by the Prime Minister to save face and hope that the people in his party would forget all of the largely unpopular measures he pushed for under the idea that, well, he didn't succeed, so he had the strength to quit. What a hero. Prime Minister Sipilä's healthcare reform was controversial. Proponents of the reform say it would have driven down costs for health and social services, centralized and streamlined care, and improved the quality of services. Opponents, however, argued that it handed over our healthcare systems to private companies, jeopardized the availability and quality of care for people living in rural areas, and would actually drive up costs for the customer. Earlier this year, there were several high-profile cases of elder abuse and neglect at privately run senior care facilities, which resulted in many people questioning the outcome of the Prime Minister's proposed reform. Another issue was that the Prime Minister made multiple claims about how his reform would work, but there was never any true concrete evidence of how and what it would do. The government was being asked to support a vague proposal and make decisions without knowing what the final outcome would even be. Now that we've gotten all that out of the way, let's talk about prenatal, postnatal, and maternity care in Finland. Now, I'd like to start by saying that I only have one child and that she was born here in Finland. I have no experience with being pregnant in the US, but I do have over 20 years of experience with the American healthcare system for other issues, so I think I'm in a good position to compare the two. I took a pregnancy test in February 2014, which was positive. The first thing I did was call Neuvola, which is the service that handles pregnancy and children's health. A few days later, they had me come in for a basic consultation where they asked me about my family, how I felt, whether or not I wanted the baby, and so on. They also gave me a lot of papers and booklets to read, recommendations for vitamins and diet, and some other things that I don't remember because this was 5 years ago. I started seeing a nurse regularly, and every so often there would be a doctor present as well. The nurse would check the heartbeat, measure my stomach, and talk to me about how I feel. The doctor would do the same. I had a relatively easy pregnancy, so I only needed to see the doctor several times at the major milestones. At 12 and 20 weeks, we had ultrasounds to check how the baby was growing. At 22 weeks, I was given the infamous Finnish baby box, or maternity package, which was full of clothes, bedding, and other baby and postnatal needs. To be able to get the box, I had to fill out a form and prove that I had been receiving prenatal care. Otherwise, I just submitted the form and the box came in the mail a few weeks later. None of these examinations or services cost anything. Nothing. All of my prenatal care was completely free. My maternity leave started at 36 weeks. Since I was unemployed during my pregnancy, my maternity pay was something like 520 euros a month after taxes. If I would have been employed, my maternity pay would have been a certain percentage of my monthly salary. I gave birth on 29 October at exactly 40 weeks and stayed in the hospital for 5 nights. While in the hospital, I had 1 surgery and 1 procedure, an epidural, lots of painkillers and medications, a private room for me and my family, 3 meals and 2 snacks a day, examinations regularly of me and the baby, and even received a bag of diapers and product samples to take home. The total cost for all of this was roughly 200 euros, or $35 a day, which was the daily fee for living in the hospital. At this point, I'm going to throw up a picture of Finnish hospital food, because it was honestly one of the best things about being in the hospital. It was absolutely delicious, nutritious, and made me feel really good while all of this was going on. I should also mention that we had a private room for the price of 35 euros a day, but that was only because of my disability. If I would have been abled, I would have been either in a shared room for that price, or I would have been charged 60 euros a night for the private room. But I still highly recommend the private room if you can afford it. A week after my daughter was born, my nurse from Neuvola came to our house, rather than us having to go there. She examined my daughter and asked me how we were feeling. After that, examination returned to their office and happened every 2 weeks until my daughter was a year old. Then they were every 6 months, and now they're once a year. These also cost absolutely nothing. It also costs nothing if I need to take her to the doctor if she's sick for basic doctor needs. Specialists, however, cost. Now, my daughter has had multiple eye surgeries, and these do cost. Each surgery has been 90 euros, and sometimes that has included the price of her staying overnight. This is why I can be a little critical of the system. When she was a baby, I was still on maternity leave. On paper, I should have been the one to take her to Helsinki for her surgeries, but I couldn't, because I was and am blind. But her father was unable to get sick leave for these appointments because I was on maternity leave, which caused us to have a very difficult time financially due to the fact that we not only had to regularly drive to Helsinki, but sometimes provide our own accommodations and take unpaid days from work. Situations like ours are rare, but they do happen. These days, her checkups cost 36 euros. She gets 1 free pair of glasses a year and is doing just fine. So what's my point in all of this? Why am I sharing such a personal story? Well, I'm tired of the misinformation, more than anything. Finland is the best country in the world to be a mother, period. This has been stated by multiple studies over many years. And while our healthcare isn't perfect, I'd rather be sick here than in the US any day. In the US, I had to always think about what my insurance would or wouldn't cover, and where I could go if I got sick while traveling. Here, I don't actually need to think about anything. If I get sick in a big city like Helsinki or in a smaller place like Seinäjoki, I can still get treated, and I don't have to think. I just show up, I see a doctor, I get what I need, and I leave. This feels like deflection more than anything on behalf of Nikki Haley. It's easier for people like her to point out that Finland isn't perfect, rather than to admit that the US has a long way to go. Because yes, Finland isn't perfect, and if people like Prime Minister Sipilä get their way, things might end up even worse. But we are in a totally different class than the US. In fact, the US could learn a lot from Finland, but that would first involve American officials to admit that they're not the greatest country in the world, and that's something that I don't think will ever change. I grew up in the US. I remember all of this. I remember the constant propaganda in school about how we're the best, and if you don't think we're the best, then you're a terrorist or a traitor. It's hard for Americans to believe that there are countries out there doing things better than we do, but it's the truth. And I think Finland, while flawed, is probably the best place to live. So, thank you for watching. Hopefully you enjoyed my first ever video essay. This feels crazy. I'm not used to reading from a script, as you probably heard. I do a lot of voice acting, but usually I memorize my lines first, but that was a lot of text for me to memorize, so it just wasn't possible this time around. But hopefully I'll get better at this as time goes on. It's really hard for me to read, as most of you know, since I'm blind. But anyway, I hope you like this. Feel free to share it. If you have any questions about the Finnish system, I highly recommend you check out the website for Kela, which is the service that handles kind of health and social stuff. Kela.fi, Kela. I'll put the URL there on the screen. There's a lot of information there about how things work, actually, in English. I'd also recommend talking to Finnish people. And not people who used to live in Finland, but people who currently live in Finland and who currently deal with services. And even then, I recommend being a little bit skeptical with everything they say, because especially Americans sometimes love to complain. That is, I think, the American in Finland favorite pastime is complaining about stuff. And I mean that in the most kind, lighthearted way possible. But yeah, thank you so much for watching. Don't forget to subscribe, and thank you.